Welcome. In this lecture, we would understand some of the schemes for health. The first one is Ayushman Bharat. We already know the coverage is mainly for the various kinds of illnesses which have been given, and the two important components of it are the Health and Wellness Center and the Pradhan Mantri Jan Arogya Yojana. Now, the Jan Arogya Yojana was launched in 2018, and the idea was the health insurance for a coverage of people with nearly 5 lakh rupees per family per year to be given for secondary and tertiary care hospitalization. It covers 3 days of pre and 15 days of post hospitalization period, and would also cover these following things within the coverage. Now, besides this, there are various other beneficiaries which have been mentioned. So those have been classified under different names. D1 is families which reside in one room with kacha walls. D2 which do not have any adult member. D3 who do not have any adult male member. D4 where there is a disabled member. D5 of SC/ST household, and D7 of a landless household. Then there are urban beneficiaries. So those were the classification for the rural. In the urban, it is various categories of rag pickers, beggars, domestic workers, sweepers, construction workers, transport workers, electrician, washermen, chowkidars, and so on. Then in India, we know malnutrition is a big concern. We have been working on various diseases causing diets and health promoting diets. So we are actually shifting from health promoting diets to disease causing diets. And then talking about the issues of modern lifestyle, the main focus is building up nutritional status, stamina, endurance, and work capacity. Universal health care coverage would focus on service delivery, health financing, and governance. Now, under financing, it mainly concerns with health services, infrastructure, medicines. Under healthcare, equity and a bias-free health services, which mainly focus on preventive, rehabilitative, and curative services. Equity, which is basically targeting on the vulnerable group, providing service delivery to marginal and vulnerable population, women, children, and elderly. So for this, we need to have a good preparedness, improve the national preparedness plan, a good governance which would facilitate dialogue between the various stakeholders, and then there are certain indicators for tracking the progress. What are those indicators? The maternal, reproductive, newborn, and child health, infectious disease. Among this, we have TB, HIV, then non-communicable disease like BP, sugar, cancer. Then the service capacity, how many hospitals are there, what is the hospital health worker density, what are the essential medicines required, whether there is compliance with it or not. The infant mortality rate over the years have been lower, and the life expectancy has increased. So what has been the chart there again becomes important. Under the sustainable development goals, we have highlighted investment in health system can prevent nearly 97 million premature deaths by 2030, and this has been given by WHO. So under the Asthana declaration, we focused on universal health coverage, and those are some of the things which are mainly related to health environment, primary healthcare, government priorities for healthcare, aligning the proper strategies and support systems. Then, fighting with the COVID, India is mainly focusing on research, academics, industries, startups, and individual innovators. We have a huge population which lives below less than $2 a day, and 30% of the population has less than $1.25 per day available and are considered extremely poor. So, government has announced an economic stimulus package for the same. Then is Thermaissance. Now, this is the mission to reduce the healthcare associated infections. Now, fabric technology has scientifically been tested by ISO certification under various laboratories and can deactivate 99% COVID virus, staphylococci, pneumoniae, E. coli, and other bacteria. The technology has been working constantly, killing the various germs, and use of fabrics to make the medical textile have been improved. We are also trying to reduce the infection by making people stay fit. Reducing the mortality by this means is again important. Then we have under Atal Incubation Center startups, there have been few case studies which are given here. The first is the Aesthetic Robotic Solution. This is a startup which has developed isolation pods for infection control. Patients infected with severe infection would be given a positive or negative pressure chamber, and their exhalation cannot directly mix up with the environment. So India's first individual patient isolation solution for healthcare has been provided by this. Similarly, is the Crowd is Spital Private Limited. Now it is a manufacturer for doctors and hospitals and provides 25 types of body details through self checkup, free workout diet and lifestyle plans, and it has working in patent with AIMS Patna for specialized products for COVID patients, and also a PICU digitalization project has been under it. The next is Ubicare Health. It is Bengaluru based, which aims at healthcare being ubiquitous, that is available to all, easily accessible, and providing mobile healthcare as a service platform. So specialists and hospitals would deliver follow-up care to the post-acute and chronically ill patients at home. The next is Red Spectra Instruments Private Limited. Now this basically is working on probiotics beverage fermentation, reducing the time of fermentation without compromising the quality. Yoga again is important. 2021 has been the theme for the International Yoga Day as Yoga for Wellness. It is now observed across 190 countries, and in India by Patanjali, this concept was given nearly 2000 years ago in the Yoga Sutra, and this has been told as the cessation of movements of consciousness. Yoga has originated in ancient India. Dr. Iyengar basically talked about yoga as meditation in action. We have various platforms through which yoga cure has been given. Now R. Nagarathan from SWAS, which is the Swami Vivekananda Yoga Anusandhan Sansthan in Bengaluru, has achieved success in curing cardiovascular and chest related problems in the patients. Now there are various asanas which have been given. Also there is Namaste Yoga App by the Ayush Ministry, which focuses on the yoga centers, events and trainers. The certification courses, the Surya Namaskar initiative, which is a set of 12 asanas performed for body and mind. And Ministry of Ayush launched nearly 75 crore Surya Namaskar initiatives on the Azadi Ka Amrit Mahotsav. Then we have a holistic treatment. So various problems. For example, these yoga postures are good for thyroid. These given are good for diabetes, and so on and so forth. So the list is given here. You have those lists in the handout. You can check those out. The next is the National Family Health Survey 5. Now this shows that the total fertility has declined. The replacement level has been achieved in 19 of the 22 states, with only Manipur, Meghalaya and Bihar left above the replacement rate. The contraceptive use have increased. The family planning needs have seen a significant improvement. The regional variation has indicated significant changes in the following states in terms of clean cooking fuel. Then we have more than 90% of the households using clean cooking fuel in Delhi, Goa, Chandigarh, Puducherry. 50% of the households using clean fuel in the following states. Then we have also seen that some of the least performing districts are from Bihar, and the following are the districts. Similarly, in Assam, the lowest change has been seen in the following districts. Coming on to total fertility rate, we have seen that the average number of children per woman has declined from 2.2 to 2 at national level, and at the 14 states and union territories from 1.4 to 2.4 in Uttar Pradesh, 1.4 in Chandigarh. Similarly, the contraceptive prevalence has increased from 54% to 67%. There has been a significant decline at all India level in most of the developments. Immunization drive has increased from 62 to 76%. Institutionalized births increased from 79 to 89%. There has been child nutrition indicators. Now under this, first of all is empowering the women. Then is breastfeeding for the child for first 6 months. Curbing household air pollution, which can give rise to higher comorbidities. Then we also, under this initiative, we have the PM-Ujjwala Yojana, which talks about the LPG subsidy, and this is under the Give It Up campaign. Then we have the rural healthcare infrastructure. 70% of the population lives in rural areas, so sub-centers, primary health centers and community centers to be built. ABHIM, which is the Ayushman Bharat Health Infrastructure Mission, focuses on developing infrastructure for health. addition of new critical care beds, supporting block public units and integrating public health laboratories, providing financial supports, maintaining the initiative, screening for non-communicable diseases, mother absolute affection, Surakshit Matratva, dialysis program, Ayushman Bharat, Jan Arogya, Mission Indradhanush for vaccination, Swasthya Balya Karyakram, Kaya Kalap for cleanliness and hygiene program in public regions, Surakshit Matratva Aswashan, that is for preventable maternal and neonatal deaths, Laksh, which is to reduce maternal and newborn mortality. ASHA workers have been working constantly in line for providing services. There have been benefit package which has been given to the ASHA workers under the Suraksha Bima Yojana and the Jeevan Jyoti Bima Yojana and the Shram Yogi Mandan. Then we have the emergency response COVID package preparedness which has been given. For the maternal and the child health care, we have seen high prevalence of anemia, especially in the reproductive age group and the pregnant women's. Overweight and obesity is again a higher problem in low medium income nations. The developments for this has been taken into account. Micronutritional supplements are important. So under the National Nutrition Policy started in 1993, we are focusing on nutrition specific needs. National Health Rural Mission in 2005 for affordable healthcare in rural areas. Food Security Mission in 2007 for increasing production of wheat, rice and pulses. Urban Healthcare Mission in 2013 for catering to the needs of urban poor. National Food Security Act in 2013, Poshan Abhiyan in 2018 for nutrition. Also with this we had the Anemia Mukt Bharat which was released, Poshan 2.0 merging the supplementary nutritional programs with the given program. ICDS which was integrated child and development program focuses on the nutritional status of the children under the age of 6. Then we have Pradhan Mantri Matru Vandan Yojana which is basically covering under the ICDS scheme, and the recipients would be given a MCP card and the claims would be presented within the 460 days of the child's birth. The Pradhan Mantri Surakshit Matratva Abhiyan Janni Shishu Suraksha Karyakram is another important program to eliminate out of pocket expenses for pregnant females and unwell newborns. Janni Suraksha Yojana is for safe motherhood and lowering the maternal and infant mortality rates. Rashtriya Swasthya Karyakram focuses on deficiencies, diseases, developmental delays and birth defects. So those are some of the areas that we need to strengthen. So how we can adopt a good policy? We can adopt and strengthen success stories, bring in maximum impact of the financial issues, restrict the advertising, have effective food labeling, push for agricultural policies, investing in public policies and demonstrating good leadership are some of the ways through increase this. Under Make in India, we have been focusing on the 7th year in 2021, and the initiative has made India the 4th most attractive investment destination worldwide. Now we have certain success stories of Make in India in various sectors. So in the defense, we have a planned production of 5 lakh AK 203 assault rifles, then military weapons and systems which are tank engines and radars. French drone manufacturer LH Aviation has announced manufacturing of drones in India. Similarly, Pratt & Whitney has committed to set a facility in Haryana. Muscat Dock Shipbuilders has manufactured the INS Vishakhapatnam. Russia's partnership in Reliance Defense has come up. Similarly, in manufacturing, for example, Wistron is working with Opitis for laptops and smartphones, Amazon India to manufacture electronic products, Samsung to start mobile display panels at Noida. Similarly, in the automobiles, Nissan and Volkswagen are exporting more cars out of the country. We have Daimler, which is the parent firm is the Mercedes, has infused huge amount in India. BMW has increased 50% localization. In India, Kia has started a plant in Anantapur. Hyundai is aiming to bring new electric vehicles in India. In the retail sector, Walmart and Amazon are coming up. Realme has talked about new exclusive stores. Freshpick by Reliance Retail has been released. Dyson has announced retail presence in 12 stores. Under the renewable energy, again, Adani Gas, Tata Power have signed up numerous contracts. So the complete list would be given in the handouts. You can refer those. Similarly, we have seen the developments in pharmaceuticals, mainly the AstraZeneca, which has launched the Clinical Data Insights Division. Alchem Laboratories, which has introduced ibuprofen and famotidine for osteoarthritis and rheumatoid in United States. E-health has grown significantly. Along with e-health, we are talking about telehealth through telemedicine, m-health through mobile practices, electronic health records would be maintained, wearable sensors would be given to know the symptoms of heart rate, sleep quality, oxygen level. Also, digital health would be given empowerment. And under the major trends in digital health post-COVID, we have seen virtual reality, wearables, artificial intelligence, blockchains, and smartphones as an important component. So those were some of the important things that we have discussed in this Kurukshetra edition. We cover Yojana Kurukshetra down to earth regularly. So stay tuned and stay subscribed for further updates. You can follow the complete handouts at Examrace current affairs section. You can go to based on Yojana, based on Kurukshetra, and the links are given below. Wish you good luck.